Good morning, good afternoon, good evening. My name is Rich Clark, Guide to the Right Path. So this week I'm going to be talking about the topic of depression and helping this out, which is where I've talked about anxiety the 2 weeks before. I was talking about motivation and then negative mindset. And if negative mindset, motivation and anxiety are not dealt with, it leads to depression. So depression, what is it? Well, there's a couple of different types and I'm going to explain some of them, but it's a mental health disorder that has characteristics of persistent sadness, feelings, lack or loss of interest, and this can impair the daily functioning of their individuals. It affects the well-being of many clients, both psychologically and physically, through neurobiological actions. And the way depression manifests in several distinct forms, each affecting people in unique ways. So here are the major types of depression, examples of how they impact individuals. Now, I'm going to also explain some of them, which I feel as a hypnotherapist, CBT therapist and a psychotherapist, what I can deal with, but what I also can't deal with is certain others, which I would then put onto a mental health professional who are trained in psychiatry and so forth. So the first one I'm going to talk about is major depressive disorder called MDD. This is what most people think of as clinical depression. So when we hear about clinical depression, we hear about the anxiety, the idea of persistent fatigue, and this can lead to people sleeping for 10 plus hours. They also, most people who how it affects someone is they usually gradually lose interest in all their hobbies. They usually lose interest in everything they do. They also find themselves unable to concentrate on anything where they have to plan or come up with ideas or any form of creativity. And even simple decisions like when you've got MDD is that you can't choosing what to eat, to drink and so forth becomes overwhelming. And they begin experiencing thoughts that everybody, their friends, their family, whatever they're in a job, their work colleagues, I would be better off without them. So major clinical depression, we can work with that as a hypnotherapist, as a therapist I would, but for some people, it depends how severe it is. If it's very, very severe, I would say that is someone you put to a mental health professional. Now, the next one is called persistent depressive disorder called dysthymia. And this is a chronic low-grade depression lasting at least 2 years. Now, obviously, because it's a long-lasting depression, this would mean that you would bring in the beginnings of that to help that person to then help them go to a mental health professional. So a person who lives with this is usually got a persistent grey cloud for as long as they can remember. And it functions in all their daily life. They really rarely experience joy. Now, there's a difference of people who are very dry or very melancholic, but when they rarely experience joy, that's very different. And they often describe themselves as just going through the motions. So you do hear people saying, oh, I'm just going through the motions, but some people can also say it as a sarcastic joke, unless people use humor to deflect it. But they also believe that they're constantly sad is simply their personality. So, and their friends know them as someone who's always a bit down, but managed to keep going. So a lot of this is about getting away from anxiety, helping people with their motivation and it's also you can improve that motivation to help them get through that low-grade depression. And then the negative mindset is changing that. So this is what I'm saying is if you don't work with the anxiety, you don't work with the negative mindset, and you don't work with motivation, then it leads to these types of depressions. So the next one, which a professional like myself as a hypnotherapist, CBT therapist, and a psychotherapist doesn't deal with, is bipolar depression. This depressive phase of bipolar disorder, and bipolar disorder it used to be called manic depression, or if it leads into a more extreme version, it's a form of schizophrenia or split personality disorder. So how this affects someone, a client experiences periods of intense depression that alternate with manic episodes. So when they mean manic episodes, it can be that they are incredibly sad and the next minute they're hyper, like really over hyper. And during the depressive phases, they withdraw socially and they literally step back. They sleep excessively and they feel overwhelming guilt about actions taken during their manic periods. So I've worked with clients like this who deal with certain things. They feel they have bipolar, but they don't. They have conditions which are similar, but they're not the same. And the episodes which they have severely disrupt their work, their relationships, their colleagues, family, and they struggle to adjust to their dynamic mood shifts. So when you're dealing with someone with bipolar depression, It is very, very hard to deal with. And also the other way is when we look at it as well, when you're dealing with as a hypnotherapist, because you're working with them in the subconscious, you could be working with them. If they're in a good mood, that's great. But if they're in a bad mood, then they can see things in a very different way. So they're very difficult to deal with. Me personally, I would usually not avoid working with people with bipolar depression unless, or disorder, unless I know that what they can work with, or I would work with that when I know that in the consultation call. It depends. And also, I do usually get a lot of medical records for that, but mainly I would put that to a mental health professional. Now, the next one, I actually have people in my family, and I used to suffer with that myself, is seasonal affective disorder called SAD. Now, this is a depression tied to the seasonal changes, and it typically occurs in autumn in the UK or fall in America in the winter. Now, how does this affect someone? Well, they become noticeably different each November through March, and they will experience things. So it's like the idea they kind of go into the hibernation period of like how nature does. What this with these people as well, they gain weight because they usually have a lot of carbohydrate cravings. They sleep a lot much more than usual. And this is where actually people were starting to get a form of seasonal affective disorder because, especially with the lockdowns, as if they were in the winter time, could affect them more. So where sometimes where they were actually going to work, they've actually managed to motivate themselves to go to work. When they were actually at home, it made it easier. People with seasonal affective disorder also struggle with morning wake-ups during dark winter days and withdrawals from social activities. Now, one of the things we do with that as a actual treatment is we use blue lights. We use Lumi is another one, which is they use essential oils, and that helps people put a blue light in the corner. It's very useful. And my mum suffered this because we've added this to her since I was about 12, 13. That really helped her get up. And it was something I noticed in my own family. So I've seen it. And back then in the 90s, it wasn't really disclosed as a medical condition. Now it is. The also with SAD is the productivity at work drops during these months, but typically returns to their usual self by the spring. So when you've got someone with seasonal affective disorder, you do have to be wary and also ask them to tell you about it. And the next one is postpartum depression. And a lot of therapists are not sure how to deal with this, but it's also a lot of it is people who feel this. It's depression following childbirth, and it's beyond the typical baby blues. So people, they always talk about the baby blues, and we're going to talk about this in another subject when we talk about relationships, pre-pregnancy and pregnancy and so forth later on in the series. But however, when we're looking at typical baby blues, how it affects someone is these clients experience profound sadness and emptiness after a child's birth, which obviously is very unusual because the idea of when someone has a child, it's the idea they should be, this joyous, they're happy to have a new person in their life and someone who they would like to nurture and so forth. So there is this very much, and most people, when they do this, they feel very guilty about it. So despite having wanted the baby for so long or wanted it within the relationship, they feel disconnected and unable to bond with their child. And within this, it causes a lot of issues. So there's a lot of things about why they do this. And again, it's this idea of why has this happened? So within that, we would work with a lot of CBT techniques within that because it's about cognitive behavior training and hopefully override that. They also, the people who have experienced these things, is experiencing intrusive thoughts about harming themselves or the baby, which actually terrifies them. So that's another thing as well. So this is not when someone gets postpartum depression, it's not so much with everything else you work with as anxiety and negative mindset or motivation or so forth. It is very much something what is developed. It's not something which is linked always to childhood or linked to adolescence or so forth. So it's a very tricky situation, and there's a lot of work you need to do with a client. Also, the client will also feel ashamed of these feelings, hiding them from their family or struggling with their basic child care tasks. It also is useful if the person who has depression following childbirth has a partner, but obviously there are some people who have children and then they end up the partner or the father or the person who is I was going to say the father, but obviously you can't use that word terminology anymore. But we'll say the father, the person who actually gave birth, actually was the seed. The actual. Oh, how did it say this? someone who is impregnating someone with that. So the father figure will use. So the father figure, if they leave and the person is a single mother, they will also put more pressure on them. And that's where also within their local communities about people helping them. So it's just not about family, it's about their friends. People have also getting groups who can help them with that. So postpartum depression, I have worked with not many people with it. It is quite because in fact most people who deal with it can affect everybody, but it's very tough to deal with. And I think again in that respect, because of that, I would probably put it to a expert who works within that field. You must also know, as when you're a therapist, you must know your limitations as well, and also your experience. But again, if it depends on the person. The other one is the other two left is premenstrual dysphoria disorder called PMDD, and this is severe depression symptoms tied to the menstrual cycle. Now, how it affects someone? Well, the client functions well for 3 weeks of each month, but experiences a week of severe depression before menstruation. So within this, we do hear people they have endometritis, we hear people who have fibroids and so forth. So this can also link to that as well. And during this time, clients they become irritable, they have crying spells, they experience hopelessness, and has conflict with co-workers, family members, partners as well. They normally get along with. So again, it's about finding this out and working it out where to come up with a solution. It can also lead to, from this, can lead from a form of depression, from also negative mindset, because every time they get into that, they get to that negative mindset. Oh no, every time this is going to happen, I'm going to feel like this. And the predictable pattern disrupts their lives monthly, affecting self-confidence and career advancement. And I have actually worked with friends of mine who actually had this, and I tried to work with them, but they didn't decide to want to do more therapy with me about it. But in my own personal opinion, if you work with the hypnotherapy side of this, I've tried to also learn. There's ways of working around with this, so you can learn about diet, you can learn about certain things about how this works, and also just trying to work with medical professionals, try and understand it. And also, being male, it's also that, generally we don't experience this. So we have to learn as much as we can, learn with medical health experts and research to do this. Like I said, I don't really, with postpartum depression or premenstrual dysphoria disorder, deal with this very much as a therapist. But if I had someone come forward for me to do it, I would quite happily help them. Um, Also, situational depression, and it's called adjustment disorder with depressed mood. And this depression is triggered by specific life events. Now, we can also consider this as part of PTSD, which is post-traumatic stress disorder. So how it affects someone. So it affects, we'll give an example of someone. Let's say they had a job for 15 years and they lost it. So when they do that, they would experience intense symptoms, including insomnia, loss of appetite, and pervasive worry. So within that, what they would then do is they would notice they would previously enjoy socializing, now they avoid friends and who are still employed. Their depression is also directly connected to this specific life change, and they struggle to envision a future beyond this loss. So, with this, when I would use this, yes, we use cognitive behavior therapy, we use hypnotherapy and psychotherapy, but we'd also use future life progression to show them what their life would be in the future, which would be either to show them a new job they would get. They will create their own business, because if they've done a job for 15 years, they've got experience within that field, whatever that field is, and to show them that there is another path, which is hence why Rich Clark Guide to the Right Path is about sometimes finding that person who actually needs a new direction, instead of feeling that they were only their job meant who their personality or their character was actually the person in themselves intrinsically is more important than the job they've lost or left. Now, atypical depression, which is the last depression I'm going to talk about, is depression with atypical features like mood reactivity. So people like this, is how it affects them is, despite persistent depression, they can temporarily feel better when positive things happen. A feature called mood reactivity. Obviously, it makes sense. You react to stimuli, which makes you better. And the only issue with that is they also, because of the atypical depression, they sleep excessively, 12 hours plus when possible. So very excessive, obviously. They usually eat more than usual. So you can see how typical depression could also be very similar to seasonal affective depression, and so forth. So again, you've got to always know, by knowing the different terminologies, about where it can work and what's different. And also they experience a heavy leaden feeling in their limbs. So when we said leaden feeling, it's the idea of they feel lethargic, very difficult to motivate themselves, not just mentally, but physically. And they're very, very particularly sensitive to rejection. Now, I spoke about this, about the negative mindset, how people with the social bias and confirmation bias and all or nothing have that really a big problem. So when you listen to negative mindset part one, I talk about all or nothing mindset or confirmation bias, and they are very particularly sensitive to rejection. And this is the same thing. So typical depression actually ends up coming from that. And this means maintaining relationships very difficult, as we withdraw at the slightest perceived criticism. Now, criticism can also be constructive, but people who are like this will always see it as absolutely any form of criticism is downright difficult for them to deal with. So with a typical depression, you can work with that as a hypnotherapist, but usually you would deal with the negative mindset plus the motivation, which would then usually, a typical depression would then recede and actually end up failing away or flailing away. So it kind of works hand in hand with dealing with negative mindset and perhaps anxiety as well. So with all these things, depression requires professional diagnosis and treatment. So a lot of it, even when people come to you, if they have medical reasons, let them send you medical results, medical tests, what they've had, because you need to make sure in that discovery call or whenever you're working with that person, you need to know that if you can handle or you have the ability. Don't think you're going to be, you can save everyone, because you can't. Not everybody, this is one of the big things a lot of healers make a mistake, and therapists, they think they can heal everybody, and you can't. Not everybody you can. So you have to be very professional in knowing, if you are someone someone who's experienced depression symptoms, reaching out to a mental health professional is always recommended. But it's also about knowing what type it is. So for me, like I said, in my own personal experience, I wouldn't deal with anyone with bipolar. I probably wouldn't, in the postpartum depression and premenstrual, I probably wouldn't either, because it's not it's not my field of expertise. However, I could help them if it means like 1 or 2 sessions to help them before they go to a mental health professional, which is what we call a psychiatrist or so forth. So if you do suffer with any of these, or you know people who need some help, please let me know, and go to richclark.net and go to apply to a discovery call, which is usually from 30 minutes to 45 minutes. And even there is going to be a new offer as of in 2 weeks' time, which is going to be called a mini session, which is for 40 minutes. And this is at a very reasonable price compared to what my normal sessions cost. So I will talk to you about that sometime next week, as I'll reintroduce that as a advert and so forth. But until next time, I shall speak to you soon.